Hello everyone, I would like to thank Professor Jim McWay and the Manchester Metropolitan University for arranging this really interesting conference and for the invitation to present our work. I would like to describe the Norwegian law and the treatment system and why so many steroid users are skeptical to seek the treatment they have rights to. I will try to show that steroid users exist within the treatment system and other systems. That's why we use the title Mind the Gap. I work at Oslo University Hospital, Division of Mental Health and Addiction, at the National Advisory Unit on Substance Use Disorder Treatment in the eldest psychiatric hospital in Norway. This is our building. It was opened in 1855. So in the advisory unit, I work in the Norwegian Steroid Project that is funded by Ministry of Health and Care Services. And our goal is to ensure equal health service for anabolic steroid users with health problems nationwide. And to do so, we have many things that has to be done. We are working to increase the knowledge among treatment providers about steroid use, health and treatment. We are trying to reach the general public through a social media campaign. We have clinician network and supervised clinicians, and we also provide an information service for users and their next of kin. Finally, we are doing treatment-related research in the anabolic androgenic steroid research group that is led by Astrid Bjørnebekk that presented earlier today. So what is known about treatment of anabolic steroid dependence? A recent scoping review described limited evidence and mostly case reports reporting on physical health and treatment of that. It is suggested that social support and to manage symptoms during cessation is central. When you look at the literature, steroid use is registered in many studies, but research document missed opportunities for engagement and interventions. Also, this leads us to Norway, where use of anabolic steroids and other enhancement drugs have been implemented in the politics of substance use and treatment. The Norwegian Drug Act was amended in 2013, where use and possession of anabolic steroids and other enhancement drugs was criminalized. At the same time, the patient group was given rights to substance use disorder treatment services. And it was the national guidelines actually stated that the patient group was supposed to have psychosocial support during cessation and other psychosocial interventions during treatment without describing it further, and also to address mental and physical health during treatment. But few seek such treatment. Our qualitative study exploring barriers to seeking substance use disorder treatment among steroid-using men who struggle to cease their use found that organization within addiction treatment was experienced as alienating. They saw their struggle to cease steroid use to be different from being dependent on psychoactive substances. They questioned knowledge among staff and questioned also whether the treatment of psychoactive substance dependence could be transferred to treatment of steroid-related health problems. I will give you an example of experienced alienation, and you can read the quotes and I'll give you a few seconds for that. The quotes show that a barrier was alienation due to having a healthy identity as opposed to how they viewed patients with severe substance use disorders. And that in itself was a good reason for not seeking treatment. Another barrier was that the system did not have the means to treat hypogonadism that was seen as the main challenge during cessation. You can read the quote. This quote also shows that several participants had used really high doses, and when they entered treatment, they were not ready to quit abruptly and tapered down by buying it illegally on the street, risking being caught by the police while they were trying to do something about their steroid dependence. Still, more than half of the 17 men had experience from being in outpatient treatment. There were examples of tapering by use of illicit substances, as we saw on the previous quote. Some found it really frustrating that they received antidepressants to treat their symptoms of hypogonadism after cessation. But during the course of treatment, they described supportive high-frequent sessions as essential to not restart use. That addiction treatment was useful to work on not relapsing, and that treatment of pre- and comorbid mental health problems was important, in particular in addressing motivation for use. Motivation for use is also linked to steroid dependence. It could also be seen as getting desired personality, a need for that. And this quote I would like to read. For my part, I think it had to do with me becoming myself. I felt I became myself. I felt I became how I wanted to be in a way. I was simply extrovert and much happier. So I think that was the reason to continue using it. And this participant was a victim of violence. To him, being big and strong had another meaning than having a nice appearance. By having a muscular body, he could protect himself. And this was his main motivation and also a central part of being dependent on anabolic steroids. We will now move on to a national study where 563 mainly inpatients in Norwegian substance use disorder treatment participated. We found that 36% of men and 8% of the female inpatients or patients reported lifetime use of anabolic steroids. When looking at steroid use and preferred substance, we found that more than half of the patients who had stimulants as their preferred substance had experience with steroid use, followed by opioids and cannabis. Even alcohol, that was the lowest, we found that 14% of those who preferred alcohol had used anabolic steroids in their lifetime, meaning that it's important to ask all patients, no matter what kind of substance they prefer, about current or previous anabolic steroid use. When comparing patients with and without steroid use, we found that the steroid group were younger, they had less education, more mental health problems. They initiated illicit substances earlier and got the substance use disorder diagnosis earlier. They also used more substances weekly and exercised more. As a summary, it seems like steroid use in a lifetime perspective in this sample could be a kind of marker of more serious substance use. We have shown that patients with lifetime steroid use exist in the substance use disorder treatment as it is. 2/3 had substance use problems prior to starting using steroids. And nearly half had used steroids to counteract a thin body after substance use. And 1/3 of all patients were asked about steroid use during the treatment. They also found that very few of the treatment providers had knowledge about the subject. This study shows that all patients in addiction treatment should be asked about previous and present steroid use and plans for using steroids in the future, as this is an opportunity for engagement and interventions. 8% of the female substance use disorder patients had used steroids, and most had also used weight loss drugs in addition. This number is much higher than the general population, and I will give you an example on how being in substance use disorder treatment may be a risk factor in itself for starting to use steroids. This participant in a mixed method study about steroid use among 16 women described a motivation to use steroids while in treatment. I'll give you some seconds to read the quotes first. So, being underweight and gaining weight as fat was a motivation to initiate steroids. It was also a way to handle withdrawal symptoms of psychoactive substances and to get more energy and initiative. Through experiencing the bodily change by using steroids, the participant regained her confidence and self-esteem, and also got irreversible side effects that she is still struggling with. Now I will briefly describe findings from a national prison study, the Norwegian Offender Mental Health and Addiction Study that is led by Anne Bukten at the University of Oslo. It is also part of a larger prison study called the PreSUD. Check it out on presud.no. 1,499 inmates were included, and this is 40% of the national prison population totally. We found that 30% of male and 6% of female inmates reported lifetime steroid use. And in this study, we found a similar pattern as the study in substance use disorder treatment. The steroid group was compared with inmates who had used substances but not steroids. And the steroid group had younger WHs on almost all substances. They had used more psychoactive substances in lifetime. And importantly, 6 months prior to and also during treatment. I think it's important to note that 8% of the participants, meaning all the participants, had used steroids during the 6 months prior to imprisonment, and almost all of them had ceased use. This means that they may experience withdrawal symptoms shortly after imprisonment. That is a high-risk period for mental health problems and may be in need of tailored treatment. Imprisonment should be viewed as an opportunity for engagement and interventions, particularly at imprisonment. So, what have been done to facilitate treatment seeking? And a free and an anonymous information service to steroid users was initiated 5 years ago, and it's led by the leader of the steroid project, Kristine Wisløff, who's a clinician, and she informs steroid users that contact us about possible health problems, including treatment options and what will actually happen in substance use disorder treatment. It is interesting to know that 3 out of 4 desired treatment after these sessions. And the main reason to seek treatment was mental health problems. They had both physical and mental health problems, but the reason why they wanted to quit was mainly, or most commonly, mental health problems. Still, the information service was not used as much as we hoped for, and the steroid project therefore initiated a social media public health campaign using this ad as clickbait. This and other ads as well. And when clicking on it, they entered an informational web page called the Steroid Lab, or Steroid Lab. See what happens when they get anabolic steroids. Of course, the kittens were not given anabolic steroids, but Steroid Lab in the social media campaign tries to show what may happen when humans experiment with use of anabolic steroids. And the user stories describe both the desired and undesired effects. And the viewers have used much time watching these user stories. And they have been developed in close collaboration with the users themselves. Another popular part of the campaign has been researcher facts. These clips or actually ads with the following text. Did you know that anabolic steroids can affect memory? Did you know that one can get addicted to anabolic steroids? Did you know that women can develop masculinizing effects of anabolic steroids? And the viewer clicked on the picture and got a minute-long research fact video clip. It has been viewed 400,000 times on YouTube, these clips. The Steroid Project has also produced short animation movies that are informative and scientifically based, aiming at the target groups such as the general public, steroid users, and health professionals. And they are also translated into English with English subtitles. So the thematics of the films are: what are anabolic steroids and how does it affect the body? We also describe what possible physical health problems could be, as well as mental health problems during and after use. We also have produced a film about gender-specific side effects, and finally also other performance-enhancing substances, including psychoactive substances and weight loss drugs. So, did the social media campaign change anything? The ads was viewed more than 20 million times, and the films have been viewed about 1 million times. And those seeking information and treatment also increased. Prior to the campaign started in 2018, 3 to 4 every month contacted us. And after 2018, when the campaign started, up to 20 persons per month contacted us. And it seems like after the campaign, the users are younger, have used shorter, and have less health problems as well. So this is a way to engage earlier. To sum up, it is clear that when planning and implementing new health services, the user needs and barriers should be taken into account. Steroid users may be seen as a new patient group, but I've shown that they already exist within the system, and that treatment providers therefore should take the opportunity for engagement and interventions. I've used pictures of birds to show that steroid users exist in substance use disorder treatment and in prison. We already know that they exist in somatic health services, often without telling that they use steroids. I've also added a picture of street art, a single bird from Manchester, to symbolize that I'm looking so much forward to the next opportunity to meet as many as possible researchers, practitioners, and persons with user experiences in person in Manchester one day, hopefully at a new conference. And finally, a few words about the near future. The Steroid Project and the research group are planning to test whether endocrine therapy reduces withdrawal symptoms. And we will also explore what steroid users and the treatment providers experience as helpful psychosocial interventions to cease steroid use and to treat steroid dependence. And this research will be conducted in close collaboration with Professor Jim McQuay at the Manchester Metropolitan University. And this is a picture of the research group leader, Astrid Bjørnebekk, and me last Christmas when we got funding. So it is yet to see whether we can publish a similar picture this year. Please contact me on email if you have any questions or comments. And then I would like to thank you all for your attention. Thank you.